Story 1. I started taking the injections at 50. The only difference I noticed was my sex drive being higher than when I was 18. I have been married for 30 years, so I do not get enough intimacy and had to stop before it affected my mental health. Story 2. I used to be a skinny kid. Ever since I have been juicing, I have gained about 30 kilograms of muscle. I am more confident, and I notice that men respect the physical part. Women started chasing me. I did 3 classic physique shows. I am happy that my mental game is still the same. I am calm and kind and try to stay humble. I have more energy, and recovery is excellent after training. Testosterone and anabolic steroids were never the magic pill. I expected more. It still takes a lot of hard work and dieting to get in shape. Now for the negative. My natural hormone production is damaged. Pimples on my back. Not the worst. I look older in my face. I have more hair on my back. My hairline moved a bit back. I notice that many men get a super inflated ego. Is it worth it? Yes and no. If you are a young and healthy adult with normal testosterone levels, do not do it. If you have low testosterone levels or if you are serious about bodybuilding, yes. But remember, it is possible you will need it for life once you start. Story 3. I have been doing testosterone replacement therapy for 4 or 5 years. The initial year into the second year felt amazing. It cleared nearly all depression symptoms, increased energy, and boosted libido. Most of those effects have tapered off, and now it just helps me feel more balanced. A negative aspect is frequent blood tests. High hematocrit may require phlebotomy, either by blood donation or therapeutically if needed. There is an increased risk of developing sleep apnea. Bone density and prostate issues can also occur. Monitoring estradiol and taking an aromatase inhibitor is highly recommended, especially if overweight, to prevent adipose tissue from converting testosterone to estrogen. I primarily do intramuscular injections. The best regimen for me is 1 injection every 2 weeks of about 0.7 milliliters, which keeps my testosterone level between 500 and 600 nanograms per deciliter with natural fluctuations. The injections are easy to manage and work best for my overall personal health. Feel free to contact me if you have questions. Undergoing testosterone replacement therapy was one of the best decisions of my adult life as a 40-year-old male. Story 4. It was good. I took it for about 10 years. I tried the patches, but they caused a rash and often fell off. After that, I returned to having my wife give me an injection in the thigh every couple of weeks. It definitely enhances low libido. It also significantly shrinks the testicles, which was unwelcome. Of course, it can also increase the risk of heart problems, so keep that in mind. Story 5. I get weekly injections and have for about 12 years now. At some point in my early 30s, my body stopped producing testosterone. Took a while to figure out why I felt like crap all the time. I thought the brain fog, lethargy, and disinterest in sex were just a normal part of parenting when you have young kids. Turns out there was more to it. I feel great these days and will likely stay on this medication forever. The only real negative is the weekly trip to the clinic since it is a bit of a drive. They do offer a self-injection program, but I have decided I would rather not inject myself. Overall, the benefits far outweigh the costs in my opinion, especially since we are done having kids. If you are still trying to reproduce, it is a bigger decision because it impacts sperm production. I believe I took human chorionic gonadotropin for a while at the beginning because we were considering another child. Story 6. I am 48 and my wife is 50. We both do hormone replacement therapy. She had an emergency complete hysterectomy when her endometriosis became life-threatening, so she had to start therapy. Otherwise, she would never want to have intimacy again. Also, she was having a very difficult time with sudden menopause at 44. She really liked our hormone replacement therapy specialist and had me come get my hormone levels checked. My levels were in the low 200s. The specialist said I should be somewhere between 900 and 1000 and wondered how I was able to get out of bed. We use hormone pellets. The procedure is painful for a few days, but I do not have to go back for 5 months at a time. They monitor my levels and have adjusted the treatment to where it should be. There is a slight decrease in energy and libido before I get my next pellet. I did not notice the change when I started, but my wife could definitely notice. Important things like increased libido improved, as well as simple things like me remembering to help with the dishes and suggesting lunch dates during workdays. It was not a huge cure-all change for me, but it boosted me in ways where I had forgotten I needed to put forth effort. My testicles were large before, so the small amount they have shrunk is a welcome change. I lost 10 pounds in 5 months without trying, kind of. My penis is the same size or slightly longer since I lost 10 pounds of pure fat. Studies show for every certain amount of weight you lose, the penis appears to grow, but it is really just the fat reducing around it. If you decide to do this, keep a close eye on your blood work. Some people react well or barely at all, like me. Some people cannot take it as it is just bad for their biochemistry. Good luck. I hope this helps. Story 7. I found out that I had low testosterone a few years ago. Since then, I started taking clomiphene a few times a week after discussing things with my doctor. That slowly increased my testosterone levels to where they should be over the span of a year. Since then, I feel like my entire life changed. I always struggled to build muscle and keep fat off. Energy was never something I needed to find. It was just in abundance. I felt more confident, stronger, and my body changed. Honestly, I have never been happier with how everything has been going. Story 8. I've heard that people who train use it, and I wondered what the effect would be if an ordinary average person took it. Someone mentioned libido, which I figured would be a result, but I also wonder about aggression. Do you become a manly man with a "what are you looking at" attitude? Story 9. Look into clomiphene. It boosts your natural testosterone production so you avoid any shrinkage side effects. In fact, you get the opposite effect. I did testosterone shots for a little while but switched to clomiphene a few months ago. My testosterone levels actually increased with clomiphene compared to injections. I am sitting at about 1,200 now. The levels are also more consistent since it is a daily pill that triggers testosterone production instead of just a big boost every week or two. Story 10. I have been on it for about 6 months now. I have definitely experienced an increased libido. Some of the side effects are not great, and I am starting to wonder if I should stop. I have to donate blood every other month to counteract an increased hemoglobin count. My testicles have shrunk, but to be honest, mine were on the larger side to begin with, so it does not bother me. They actually feel more comfortable now. I am also noticing that I am losing some hair and thinning at the front more than before. Story 11. It's improved every part of my life. I have been on testosterone replacement therapy for the past 12 years. I am happy, perform better at work, am driven toward my goals, and am in the best shape of my life. I have a loving wife and children that I do not think I would have if it were not for getting my hormones in check. Story 12. You must absolutely keep an eye on your blood work. My red blood cell count went through the roof, making my blood thick like oil. After about 4 years of testosterone replacement therapy, I had a heart attack at 57. Unfortunately, I have to stay on it because at my age, after 4 years, my body will not be producing testosterone ever again. Needless to say, I'm staying on top of my blood work. Story 13. I am 52 years old. I have been on doctor-prescribed injections for about 2 years. My testosterone level was low, around 200. Now it is approximately 800. I administer 3.5 units twice a week in the buttocks. There are only 2 noticeable differences. I maintain my weight much better by doing an hour of daily resistance training, and I sometimes experience no reason erections again. No mood changes. No extra energy. Nothing else. Story 14. I have nothing but great things to say. I am a low aromatizer, which means I experience significantly fewer estrogen-related side effects. I cannot name any cons except for some slight testicular shrinkage of approximately 20%. The benefits have been a huge increase in strength, unbelievable confidence that has improved my dating and sexual life, a general feeling of positivity and happiness, and more energy and drive. I was not depressed before. My life was good. Now I wake up some days feeling like I am high on life. It is a great feeling. Regarding dating, I have gone from average success to being the most successful in my group. It has definitely made me more sexually active and promiscuous, which I find to be positive. I really cannot say enough good things about it. For reference, I take a dose of 200 milligrams per week, which puts me about 20 to 30% higher than the top of the reference range for natural and healthy men. The high level of the range is 950, and my levels are around 1200 to 1300. All other blood markers are healthy. Testosterone is well tolerated by the body since it is naturally produced, so the body is already accustomed to it. Other steroid compounds have significantly higher side effects. Also, many side effects are dosage dependent, so increasing the dose to 400 to 500 milligrams of testosterone could double the side effects. Testosterone is so well tolerated that bodybuilders routinely use over 1,000 milligrams per week with low side effects. Story 15. I opted out of testosterone replacement therapy. My fear was that once you start testosterone replacement therapy, your body stops making testosterone and it can be very difficult to get it to start again. That is the opposite of what I wanted. Instead, my doctor put me on KSM 66 ashwagandha and Testojac 200, along with weightlifting and eating more red meat, eggs, and greens. I feel incredible. My levels are up naturally. I am really happy I did not do testosterone replacement therapy. Story 16. I have been doing BioT pellets for about 7 years. Sexual health, energy, sleep, mood, and recovery are all noticeably better on hormone replacement therapy than without. It has been life-changing for me. Story 17. I inject myself every 10 days. It does make a difference in terms of libido. I am in the mood more often for sure. Story 18. Microdosing 3 times a week for about 3 years now. Libido is great, energy levels are good, mood is better, and going to the gym is actually productive. I made minimal improvements the year before starting testosterone replacement therapy. I run blood tests 2 to 3 times a year, and my markers look great. I also eat clean and have reached a manageable 12% body fat level, which helps a lot with preventing some hormone and lipid issues that others experience. 10 out of 10 would do it again. If you don't at least do some walking, occasional gym work, and avoid poor diet and drinking habits, some benefits are lost in the process. This is supposed to bring you back to a meaningful testosterone level. It is not a miracle drug. Story 19. Sorry, I can't access external links. Please provide the text you want me to edit. Story 20. Male, 60 years old. I have been using testosterone pellet implants for about 5 years. I get them implanted every 6 months. They provide a great energy boost, improved focus, improved mood, and high libido. The only issue is the extremely high libido. Thank God for my wife. Story 21. 40 years old. Just started and in my 3rd week. Natural levels were 203 and 230 before I was approved for treatment. I have not checked my levels yet, as I will start checking in my 6th week. The amount of energy is incredible, and my daily motivation has increased tenfold. I feel like I am running on all cylinders, and I love it. No more brain fog, depression is gone, and I am finally sleeping without sleeping aids. I am back in the gym at least 5 days a week and already seeing noticeable gains in strength. If anyone is on the fence, I fully recommend it if needed. Story 22. 500 milligrams per week of testosterone in enanthate. Best feeling in the world. Felt strong and in a great mood. I remember leaving my apartment for work every morning and feeling like the sun was giving me a high five and telling me we were going to crush it today. I can easily see why people choose the blast and cruise lifestyle. I was also able to max out my bench press to 350 pounds. Story 23. Male, 68 years old. Started with testosterone cream on testicles twice a day about 6 months ago. Testosterone was below 200. Now around 900. I feel great again all around. No side effects to mention. I will gain weight if I do not watch my diet, but I do anyway for my health. 10 out of 10. Story 24. It was by injections every month and it helped me grow a beard. I also noticed hair on my chest. I took it because my growth and development were slow. I am happy with the results. Story 25. I have been doing it for a year. Surprisingly, my libido is not that much different. Not crazy, not bad either. Somehow countered the effects of Zoloft, an antidepressant. Overall, it has been a good experience. Story 26. Early 30s here. After a run-in with a viral infection that turned my health upside down, I was prescribed testosterone therapy. My levels were around 200 starting out. I've been on it for about a year now. Short term, energy for days, improved mood, better sex drive. Long term, about 1 year in, I've settled into a rhythm that's slightly lower than the initial doses. Missing a weekly dose can be rough. Injecting into your glutes is not as bad as it seems, but hitting a blood vessel is quite painful and can result in an incorrect dose. I'm hopeful that one day I can reduce or wean off the testosterone. However, I've come to the conclusion that COVID-19, or whatever virus initially attacked my body, has caused significant internal damage. Story 27. I am in my late 60s and feeling as energetic as ever. I am on the skinny side, but that does not matter as long as my health is good. I would never take a chance with heart disease and cancer risk. Story 28. I'm 62 and have been on testosterone replacement therapy for about 12 years. I started with the patches, but they gave me a rash. Then I switched to the gel, but I was always concerned about it rubbing off on my wife. Now, I get an injection every 2 weeks. As others have said, a boost in libido was the most noticeable change. I also felt a little more alert. The downside is that after a couple of years on the injections, my testicles went from the size of walnuts to grapes. No joke. It's purely a vanity issue, but still annoying. Story 29. I initially started a supplement after noticing that despite going to the gym 3 times a week, I was getting weaker somehow. Generally, you get stronger as you go, but my bench press was losing ground. I lost 30 pounds of what I used to do with bulk reps. Once I started taking it, though, it was an eye-opener. I think because the decline was not instant, I didn't realize how far I had fallen. Not just in muscle-gaining ability, I had become a weak, passive, apathetic person. It was like I was pulled above the clouds and could see how bad of shape I was in mentally. I finally mentioned it to my doctor, and she told me they could pull testosterone numbers from my blood work. While I was taking the supplement, it was 221. 300 is considered low. Mine should have been 800 to 1,000 at my age. She wasn't sure if the 221 number was aided by my supplement or if the supplement introduced a chemical not picked up in blood work. I have a blood test next week. I had to stop taking my testosterone a week ago. I wish I was joking when I say this, but I'm having a hard time not killing myself. I'm crashing hard. Stuff is bothering me much more than it did when I was on the supplement. Things that I could kind of just shake off, I can't. I want to tell my wife to take and hide the ammunition for our home defense shotgun until I can get back on the supplement, but I fear she will say I'm being manipulative. Low testosterone will absolutely affect you negatively. It's worth getting help. I'm hopeful the doctor will set me up with even more potent supplements after I see her next week. Story 30. Once, a maid in Las Vegas walked in on me as I was injecting myself. I only had one syringe that I bought from the veterinary shop for the whole vial and was using Grey Goose to disinfect the area. Good times. I was 21. Story 31. I have been using anabolic steroids for 5 years, always with testosterone as the base. I feel amazing all the time, with the body of my dreams and my biggest lifts in the gym. Most of the time, I experience no judgment when sharing this with people, and I am just living a great life. My laboratory work is good. I cannot say that I would not recommend it. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.